Hello everyone. Apologies for the slight technical hitches which we were having initially, but hopefully all will be smooth running from now on. So it's my pleasure to welcome you to this very special World Arthritis Day 2025 webinar, proudly hosted by the joint communities at EULAR, the European Alliance of Associations for Rheumatology. I'm Simon Stones. I am the chair of the PARE committee and I am your chair for today's webinar, and I'm joined by my wonderful co-chair, Caroline Kersen from EMEUNET PARE. So wherever you were in the world at the weekend, I hope you enjoyed the World Arthritis Day celebrations on October 12th. Each year, World Arthritis Day gives us an opportunity to come together, to raise awareness and celebrate the strength and dreams of people living with rheumatic and musculoskeletal diseases, or RMDs for short. And this year's theme is Achieve Your Dreams, and it reminds us that everybody deserves the opportunity and the support to live a fulfilling life and to pursue their goals. And over the next hour, we've got some fantastic speakers and an opportunity for you to ask your questions. But first, we've just got a couple of housekeeping points just to make sure the webinar runs smoothly. So please try to join using your computer for the best sound quality and video quality. I think everybody's muted when you join, but if not, you will be muted automatically. The webinar is being recorded and it will be shared on the EULAR YouTube channel at a later date. And we would love to see you on camera, but please keep your camera on if you can and you're able to do so. But if the connection becomes unstable, feel free to turn it off. We will be inviting you to ask questions to our speakers later in the webinar, so please do ask a question either by raising your hand or writing it in the chat, and we'll try to get through as many questions as we can. And finally, please don't forget to join the conversation on social media using the hashtags RMDreams and World Arthritis Day. So as I mentioned previously, we have 5 wonderful speakers representing different perspectives across our EULAR community. We have Caroline Kersen from EMEUNET PARE, representing the voice of young people with RMDs. We have Nina Broden, Associate Professor and Senior Lecturer in Physiotherapy from Sweden and the Chair-elect of the Health Professionals in Rheumatology Committee. We have Professor Jordi Anton, Paediatric Rheumatologist from Spain and Chair of the Paediatric Committee. We have Diego Benavent, the Consultant Rheumatologist from Spain and Chair of the Emerging EULAR Network, or the EMEUNET Committee. And we have Professor Margriet Kloppenberg, Professor of Rheumatology from the Netherlands and Chair of the Advocacy Committee. And each speaker is going to share their reflections on how we can all empower people living with RMDs to achieve their dreams personally and collectively. So each speaker, as we go through presentations and hearing the dreams, I think of the personal dreams of our speakers, but also the dreams of their communities that they represent. And they're going to do that through a short presentation. And I'm really excited to hear these dreams and look at how we can further enhance what we do as a community with all of the different perspectives involved. Because I think we all realise that the work that we need to do needs to be collective, not just people living with RMDs, but all of our clinical, academic and advocacy colleagues together. And so with that, it is my pleasure to introduce our first speaker, who is Nina Broden, representing the HPR committee. So Nina, the floor is yours.
Thank you so much, Simon, and hi everyone. Welcome to this wonderful hour that we will have together this afternoon. If you could change to the next slide, please. Yes, so I'll be sharing 3 of my dreams for the future. And the first one that I would like to highlight is my dream that we will all have a person-centered approach in our work with patients. I think it's central for many of us already. We know that it leads to increased feelings of security, content, and reduced needs for healthcare services if we use it in the encounters with patients. It also makes sure that the individual's needs, resources, and abilities are in focus, which enhances the effectiveness of care and the quality of life for each patient. But it also leads to higher satisfaction with work and less stress among healthcare providers. So based on that, I think it's obvious and very clear that we all should have this approach in our work. So my dream is that this approach is unquestionable in all healthcare encounters and by all professionals. I do think that we need to work with education and discussion together to reach this goal, but I don't think it's impossible. It might take some time. Next slide, please. My second dream is that the competencies of health professionals are acknowledged and used in the work towards better health for people with RMDs. And I would like to stress this wish on many levels. From the smallest clinic, where the personal encounters between a healthcare professional and a patient takes place, through referrals from rheumatologists to healthcare professionals, where you can really help patients on top of the effects that you get from medication. But all the way up to national and international level, where we know, at least from a European perspective, but also from a world perspective, that the use of or the acknowledgement of healthcare professionals' competencies varies very differently. I do think that we need to work with more guideline documents. We also need to work for more translation of existing ones to encompass for a better use on national level. And it also leads me into my third wish, which you can see on the next slide, which is that non-pharmacological research is acknowledged and funding opportunities are provided nationally and on a European level. And today it's very tough competition to gain funding for any type of research, we should say. But I would like to stress that it might be even tougher for the non-pharmacological research, as there are, for very clear reasons, no pharmacological company who would fund the pill physical activity, even though it's a pill that we know gives almost no side effects and only positive benefits, and it's also quite cheap. But I think we need to work together to highlight the research that is already there from the healthcare professional side, but also work together to strengthen and make it more visible that this type of research can actually lead to a lot more of treatments that can give very good effects to patients. Yes, those are my dreams. Thank you.
Thank you, Nina, and I think a really lovely way to start us off, and really just capturing the importance of allied health professionals in providing support and care for people with RMDs. So I'm sure people will have questions, I know I do, but we'll save those to later on. And I think that's a nice transition into our next speaker to focus on the paediatric and adolescent side of rheumatology and the importance of supporting young people and families in care in childhood and also into adulthood. So I'm really delighted to introduce Jordi to give his dreams and the dreams of the paediatric community. Over to you, Jordi.
Thank you, Simon, and thank you to all of you who today are here. I mean, we celebrate World Arthritis Day and with this topic of achieve your dreams. So it's not only to raise awareness, but to celebrate hope, resilience, and the power of dreams. And especially for our young and children and adolescents living with rheumatic diseases, it's also important. In pediatric rheumatology, we face unique challenges, but every challenges, I like to believe it's also an opportunity to innovate, to collaborate, and to dream bigger. And let me just share 4 dreams that I have, and I would like to improve them to make a reality. Next slide, please. First update, it's to improve access to trained pediatric rheumatologists. Next, it's this is the real world that we have still, that there are some areas of Europe where we don't have a good coverage of pediatric rheumatology. So we need a good access to specialists, improving the distribution of pediatric rheumatology that brings expert care closer to families in need. Also, it can help telemedicine expansion. I mean, and something that we learned after the pandemics in 2020. We need to strengthen referral networks in order to robust them and ensure timely diagnosis and treatment by connecting families to specialized care. And also, we need the benefits of early diagnosis. We know that as in some adult diseases, rheumatic diseases, in some pediatric rheumatic diseases, as soon as better, and that it's improved the outcome of patients and foster hope and resilience for patients and families. Next slide. Ensure rapid access to pediatric rheumatology care is important because, as we said, the timely of care, the streamlining referral process, and also it's this very linked with awareness and training. It's important to have public health campaigns and professional training help to detect early symptoms, identification, and a more primary care providers, pediatricians in primary care, family physicians that can quickly recognize and send these kids to a specialist. And also we need to improve infrastructures and staffing, not only for pediatric rheumatologists, but also for early health professionals that work with our kids in improving their quality of life. Next slide. It's important also to see when we work with children, the support that we are facing with all the whole family. It's important to recognize how these diseases impact the entire family, how chronic illness affect patients and families emotionally, also financially, psychologically, recurring comprehensive support. So it's important to have holistic care support, providing emotional, educational, and social that empowers families to actively participate in this child's care and journey. And that will for sure help that positive health outcomes through supported families feel children secure and resilient, which also will help them for the next stage of their life. And this brings us to the next dream. The next slide, please. Is the strengthened transition to adult rheumatologists. I mean, it's important to recognize that children are evolving since sometimes we have identified pediatric rheumatic diseases and just one age, 4 or 5, till they are 18, 16, 20, and they go to adult care. And all this process, children are evolving and we must adapt. And it's crucial the time when we arrive to transition to adult centers. It's important to have structured transition programs that prepare adolescents for the responsibilities of managing their adult rheumatic care effectively. It's important to have collaborative care teams, multidisciplinary teams that ensure communication of medical histories and treatments. It's important to empower adolescents to know their disease, to take care of themselves, to build confidence and be able to explain their disease in their communities also, to maintain adherence to their treatments. And so it's also important as a big dream to invest in these transition protocols that for sure it has been shown that can improve the quality of care of these children and adolescents. And these are 4 dreams for that we would like to see in the next years to improving our care.
Thank you, Jordi. And I know it's really difficult to pick dreams when we all have so many, but I think you've really nicely captured the dreams of the pediatric community, especially I think the focus on the family approach and realizing that these conditions don't just affect the child living with these diseases, but also the wider family. And we really must do all we can to support all members of that family as they move through this condition and into adulthood, as you nicely described. So thank you so much, Jordi. And that's a nice transition over to adult rheumatology and our emerging academics and clinicians in rheumatology who are developing themselves and developing their roles within rheumatology. And it'll be really nice to hear now from Diego, who hopefully will give some nice dreams to the future rheumatologists and researchers paving the way for a brighter future for people with RMDs. So over to you, Diego.
Thank you so much, Simon, for the introduction. It's wonderful to be here in such a multidisciplinary environment. And as Georgie just mentioned, sharing the dream is a great way forward. As the old adage says, the future belongs to these who believe in the beauty of their dreams. So that's why I would like to share 3 dreams with you. Next slide, please. The first one is the dream that timely and accurate diagnosis becomes the norm, regardless of postcode and background. And actually, we have an important problem in medicine in general, in rheumatology in particular, with diagnosis delay. Let's take some example of disease such as axial spondyloarthritis. We know that there is a diagnosis delay of a median of 7 years. And therefore, we have this dream of having more standardized referral pathways, maybe introducing imaging that we did not have before, as we are doing in some diseases, such as, for example, giant cell arthritis. For this, it's critical to have training of non-rheumatologist clinicians in rheumatology and also of healthcare professionals so that we can tackle the disease before. And research is also a very important step. We need indicators such as public reporting of time to diagnosis to better understand the factors that lead to diagnosis delay. In my next slide, I'll show you my second dream, which is that social support should be embedded in rheumatic and musculoskeletal disease care. And this will include peer networks, mental health, and workplace accommodations. Because in rheumatology, in rheumatic diseases, there are many different domains that are affected by a disease or that may be affected by a disease. But today, the reality is that in most consultations, we focus in 1 or 2 or 3 domains, like a disease activity, for example, is the main driver of decision. But there are many other domains that are critical for a good health. So for this, I consider that routine mental health screening is very important in every consultation, and to take attention to integrated social services and workplace accommodations. For doing this, I believe a critical point is to collaborate and develop peer and caregiver networks, such as patient associations that are growing more and more across the globe. And with this, I would like to move to my last dream, which is the dream that novel diagnostic and therapeutic breakthroughs reduce preventable pain and disability. And for this, with all the new technologies that are emerging, I am confident that we will get to risk-stratified early intervention. Maybe some biomarkers, some new imaging tools, some digital tools can help us better diagnose and treat patients. And also, learning health systems with interoperable registries can provide support to leverage all the information from electronic health records. And with training of rheumatologists, training of healthcare professionals, of patients, this will, at the end of the day, help us every day in every way to make a better rheumatology. So these are my dreams, and I'm very happy to keep on listening the dreams of all the colleagues.
Thank you, Diego, and so much covered in those few slides. But I think the future of our rheumatology profession is in such safe hands with our new and emerging colleagues because of this multidisciplinary focus and the importance of recognising that wider social network as a key to improving health outcomes. So, no, fantastic, Diego, and some really important points which I'm sure we'll touch on in the Q&A. Our penultimate speaker is going to be Marguerite from the Advocacy Committee. So it'd be really interesting now to hear how all of these dreams are being leveraged up on a political level with our colleagues in the European Union, and also for some key messages for people outside of the European Union, but what we can do to drive change with policymakers. So Marguerite, over to you.
Thank you, Simon, for the introduction, and thank you for the invitation to be here and talking about dreams. And talking about dreams, I must confess I have many dreams. And can move to the next slide. And as a rheumatologist and as a person with an inflammatory rheumatic disease, my biggest ultimate dream is that we find a cure for rheumatoid arthritis and also for all other RMDs. Next slide, please. As a chair of advocacy of EULAR, my biggest dream is that whenever I meet with a policymaker, they really know what an RMD is, that they already upfront know, that they've heard about it, and that they also want to help us. And I must say, in the activities we undertook over the last period, I believe that we can make this dream a reality. And activities we undertook that are very hopeful there is that we were able to set up, together with engaged members of European Parliament in Brussels, a European Parliament interest group. And with this interest group, we want to make sure that RMDs are prioritized, and also that we achieve that there is a European Commission strategy where we can achieve that RMDs are more effectively treated, managed, prevented, and diagnosed. To also, there we also work together with policymakers with a focus now on employment and on disability, because we want to make sure that persons with RMDs can have access to work, can maintain their work or return to work whenever that's necessary. And there we take now concrete actions, because we ask for flexible and inclusive workplaces. And we are happy there that we can engage with policymakers on these topics. And I want to mention the meeting we had with the team of the Executive Vice President of the European Commission, who is responsible for social rights and employment on these topics. We were also able to give our input on EU initiatives on fair work, and we will speak with our European Parliament interest group on the 4th of November, also about employment, and hope that many policymakers will be there and that we can reach them. And we are also happy there that our advocacy member, Fran Carrera, will share his experience with working while having an RMD. And then I have another big dream, and that's on the next slide. And that big dream is that when policymakers talk about women's health, I hope that they directly, automatically also will think about RMDs. And RMDs especially affect women. And now we see an escalating RMD crisis. The prevalence is only increasing with aging of the population, with negative lifestyles. And on the other hand, we also see a shortage in rheumatologists. So especially women are hurt very hard, or hit very hard with this escalating crisis. So therefore, we really ask for a gender-sensitive healthcare, for gender-aware care path, where we can ensure that also women have an early diagnosis and early treatment. That in research, there is also a focus of the gender and sex aspect, and that there is support for carers and work and the workforce, where especially women with RMDs are very vulnerable. Now, we are happy that also there we can make our dreams come true. We were able to speak about this topic with Peggy McGuire. She's the director of the European Institute of Women's Health, and we also endorse their manifesto on this topic, and we could work closely together and gave our input in a committee of the European Parliament on health and women's rights. That's currently a big topic there, and also on a European Commission that now works on a strategy for gender equality. So we really hope that when they work that out, they also will think about RMDs and don't overlook it. And with this, I want to end, and I believe that with the help of everybody, we can really make progress and that we can make these dreams come true.
Thank you, Marguerite. I think a lovely summary and just a small snapshot of the activities that yourself and the Advocacy Committee are working on with our policymaker colleagues to really make those system level changes happen, because we know RMDs are amongst one of the most populous conditions in Europe, and yet there's so much support that needs to be in place to enable people to live a better and healthier life. So fantastic work that's happening, and I'm sure there will be questions around some of those interactions as we move into the Q&A quite shortly. But before we do, we have our final speaker, who is Caroline Kersen from EULAR PARE. Delighted to have Caroline here, representing the voice of young people, an often marginalised group of individuals who need to be heard and need to be empowered to live well with RMDs. So, Caroline, it's my pleasure to introduce you, and over to you.
Thank you, Simon. So, yeah, I'm Caroline, and I was asked to share the perspective of young people, right? So the way I went ahead to do that is first of all, I thought, okay, what are my dreams regarding RMDs? Next slide, please. So I went down and made a list and was like, okay, of course we have the more obvious dreams. We have I will never again want to hear the aren't you too young to have an RMD, but you don't look sick. Stuff like that, which every patient with an RMD has heard. Then the other very obvious dream is to have effective treatment, maybe even a cure especially for fatigue and for pain. Then I was like, okay, those are very, very big dreams, right? So how can I make all of that a little bit more feasible and also more realistic? So I was like, okay. One thing I am missing right now and would be really important for me personally is to have a holistic approach, to have a treatment team where doctors, HPR, mental health experts all work together and create interdisciplinary teams and treatment plans where they actually work together and not just next to each other. With that comes that it's important to know that an RMD affects all areas of life. And my big dream is that doctors, HPR, patients, but also people who are not patients or health professionals in any way, know about RMDs and how it can affect someone, right? And then another part I thought about was including the impact of the hormonal cycle of women, because we now know that the hormonal cycle in women can be a big impact on women's health in general. And as far as I know, there's still not a lot of research and knowledge around how it impacts RMDs or medication for RMDs. So that would be a big dream of mine to know, yeah, how does it impact my sickness? And then all in all, my biggest dream, I think, is to just live a fulfilling life, to be able to do what I want to do and yeah, be happy. Okay, so those were my thoughts, and I was like, okay, I cannot talk for every other young person. So I went ahead and asked a Young PARE working group and posted on Instagram and asked about their dreams. I shared the slide to a Mentimeter. Next slide. A link to a Mentimeter. And I got 11 responses, which is not super much, but better than nothing. And I love to see that my dreams, my thoughts were actually mirrored in the responses I got. I have the awareness that people know what it is, to feel understood, but also to be a voice for change, to inspire others. We have the living a fulfilling life, being able to work, to travel the world, have hope, and just feel good and be active. So in conclusion, next slide, please. We have two major topics in my thoughts and also in the responses I got, which is just awareness, being able to raise awareness and inspire others, voicing your journey, being able to speak about it, but also getting the awareness that it's better known all around. And of course, the dream of having low up to no impact on one's life. And I'm delighted that all of my points were already mentioned by someone else before. So thank you for listening, and it's great to see that everything kind of works together, right?
Absolutely, Caroline. Such a lovely complementary set of dreams there from across our different communities. So thank you so much for sharing. You raised some really important points again. That the awareness piece is so critical and something that I think we will never stop doing. But then also in that previous slide where you'd reached out to the community, the young PARE community, and that being a voice for change. And I think that's something I'd particularly like to draw on as we move into our Q&A and how people can get involved in shaping the future. So with that, I'd like to first thank all of our speakers for really powerful and inspiring contributions from their summary of their dreams. What we're now going to do is open the floor for discussion and questions. I realise some people may need a bit of time to reflect and to warm up with some questions. So if you're feeling brave, please raise your hand in Teams and we'll come to you. Or if you'd rather pop your question in the chat, please do whatever's most comfortable for you, and we'll try to get round everybody's questions. So while that's happening, while people are starting to come up with their questions, I'm going to come back to you, Caroline, and I want to focus on the stereotypes which young people with RMDs still experience. And I experienced this many years ago, and it's really sad that we're still having to say that it's not just older people who get RMDs. So from your perspective, how do we challenge stereotypes in the current climate to make sure that there's never that quote again where people hear you're too young to have an RMD?
That's an excellent question. I think it is really just about being seen and being loud about it, right? So that people just experience that there are people that are young persons who have an RMD, and if they never knew about it before, that they are like, okay, I learned that now. And I think that's the only way to do that, is to share our stories as young patients, because that's what reaches people, right?
Absolutely. And I think, hearing those personal testimonies, it's not just a nice thing to share those experiences, but it really does make people stop and think and reflect on any kind of preconceived judgment that they may have. So, really important point. I'm going to come to Nina as well now, because we know HPRs play such an important part in multidisciplinary care. And I know you touched on the focus on person and family-centred care. So I wondered if you have any particular examples or things that you've seen works really nicely around good person-centred care that have really transformed health and also patient-reported outcomes.
Well, I know that there has been a few research initiatives which have studied in detail how the effects of rehabilitation programs can turn out if the approach is more focused on the individual's needs rather than maybe only using standardized questionnaires and so on from start. And I know there's one program from Norway that has been published a few years ago, and there's one program from Denmark that's ongoing. But I think we need to turn to like more the bulk of research on person-centered care itself to really find that nice essence of many healthcare professionals tend to think that I don't have time to have such a way of working. That's not for me. But the fact is, it saves time. Because if you direct the focus to the patient's need from the beginning, you might not need to ask them to fill in all your questionnaires in order to find out what the problem is. You can actually just ask them. So it has become very clear that using the patient's needs and wishes by asking them to for example, in a physiotherapy, from a physiotherapy perspective, to ask what activities is it that you struggle with, and then you break that down into the body functions and the activities needed to perform that activity. You can actually tailor your entire exercise program or your session and the advice that you give to your patient in a very explicit way. But I would say that there is a need, in order for this to need to be spread even wider. We do need more research investigating these effects.
Absolutely. And I think you raise a really important point there, and the almost, the short-term increase in workload and activity actually has much better long-term outcomes and actually reduces, you would imagine, workload in the future by focusing on that individual at the start.
Yeah, definitely. And the fact is that it's not even an increased workload right now. It's that people think it is an increased workload, but it's not. So it's actually time saving all throughout the continuum of care.
Absolutely. Absolutely. And we're having some questions coming in, which is fantastic. So I've got two in the chat, and then I think we'll come to Andy Kelly as well. He's got his hand raised. So I'm going to direct this to Caroline. So Coralie has asked whether you have any advice for patients who'd like to share their story and reach people with their experience, but who are maybe worried about disclosing openly that they are in fact living with an RMD or indeed another condition. Do you have any advice or tips and tricks for people who are considering sharing the story?
I think it's super important that we find something. I thought about it for a minute when I saw it in the chat, and I came to the conclusion that I don't know any way right now, but maybe it's something that we should create a way for people to share without having to disclose the fact that they are patients, because I can understand why people wouldn't want to do that, but still are willing to share their stories. So it's a very interesting question. I would love to give you a great answer. I don't have one. I'm sorry.
I know it's a very sensitive subject, and I think that's one of my dreams, where we live in a world where people feel free to say exactly what's on their mind, exactly what they're living with, and that everybody then accepts that and works with them to achieve their dream to live that fulfilling life. So maybe Coralie will touch base as well after the webinar to discuss. Moving on to Debbie's comment from EMEUNET. So this is directed at Marguerite. So Debbie's asked, is there any information on the topic of working with RMDs towards the European Committee? I'm just very interested in that topic.
Yes, I think that it's also an important question and an important topic, and it's also seen now by the European Commission as an important topic. So yes, currently in the European Commission, they actively work on work. I mean, they are developing a strategy because they realize that it's very important in Europe to be competitive on a global level. And when you want to be competitive on a global level, then of course we have people in Europe that are needed to work. And with that perspective, they of course look for all those determinants or factors that can influence people being able to work or not. And of course, disability is there an important cause because what they see is that people, when there is disability, it's still less easy to have access and to be maintained in the workforce. And with that perspective, there is now a lot of attention for that. And that, of course, is very helpful, because then they also think about concrete actions, how you can make workplaces, for instance, more flexible. How can you be more inclusive? How can you organize work in a different way? So yes, this is an important topic. And it can really help, I think, persons with RMDs.
Absolutely. And I think that the weight of the decision-making individuals putting that pressure onto employers to say you need to adapt, because people who are supported in their workplace are more productive, and work productivity is a really important outcome, but it's all part of that same conversation. And I think quite short-sighted from employers who don't necessarily realise the value that their employees can bring if they are supported. It's such important work. Wonderful. We have a question from the audience, a live question. So, Andy, I'll go to you for that question, if that's okay.
Thank you, Simon, and thank you for organising the meeting and for all the speakers. Yeah, I thought I'd jump in with a live question and go from there. It's mainly for Nina and again any of the panel, really. As a physiotherapist and a patient, I'm really interested from my own research in how we develop the competencies of allied health professionals and professionals in general, both pharmacologically, non-pharmacologically, how we bring that together. So I suppose my question would be about how do you see that going? Because in the UK, I think some of the physio training can be a little bit hit and miss about dealing with specific areas. It's get a good general experience and then focus. And I think advocating for this would be, how do we focus in on these sort of competencies that people really need to develop for this area?
Well, I can start and try to answer. Thank you. It's a really thoughtful question, and I think we see the same issue in Sweden, where I work, that many individual healthcare professionals tend to want to educate themselves, but they do want to educate themselves on the best treatment in, now I'm simplifying it, but exercise of the elbow, or how to treat this specific joint, or the foot itself, or something. So I really agree, it's a problem. We need to kind of lift the area of research to dare to dig into the complex cases, and we dare to need to do research on multi-component rehabilitation, for example, and not to be so scared of that we don't know exactly what's in that black box that we give. We can still evaluate it, and we don't have to give the exact same intervention to everyone, because that person might not exist in the real world. I mean, people do have all kinds of different problems that they need help with, and so that's my main thing. And we need to, for example, in the EULAR health professional group, we need to keep discussing and lifting these areas to promote that we spread them across all Europe. And one thing that I see is also the for example, the access to get more like a European spread, the accessibility of existing guidelines, which can actually help to guide the work, is hard for some people where there is linguistic barriers. So translations, working on maybe local educational offers or courses or something that, I don't know if that's a response to your question, but
no, that's fantastic. Thank you. I think, as you say, those guidelines and making sure everybody's aware of them is a key one. And I suppose just as the condition itself is multifaceted, then dealing with lots of different organisations is exactly the same. Thank you.
Yeah, thank you.
That's a really important point, and I think the implementation of guidelines is critical. And I know EULAR's trying to have an increased focus on implementation, which does include translation, so we get the guidelines in the hands of the people who can influence change. Enrique's just put the core competencies for HPRs in the chat as well, if anybody's interested in looking at those. And while we're on the topic of core competencies, I'd like to actually bring in Diego from EMEUNET to explore and sort of the key competencies for rheumatologists in a really evolving space, not just with our knowledge of RMDs, but also with other factors such as AI and other technology advances. So, you know, what do you see as some of the opportunities and challenges moving forward for rheumatologists, and how do you see the evolving partnership evolving not just between rheumatologists but patient organisations and all members of the multidisciplinary team? What do you think the future will look like with within the rheumatology profession?
Thank you, Simon. Well, indeed, we are in an inflection point in society, and we see that there are many opportunities with emerging technologies such as AI, and it's probably going to shape how we do medicine and how we diagnose and how we also treat patients. So for this, I think it's critical to consider the main actor, which are patients, and we should start by including trained patient partners throughout the whole curriculum, I will say. Bedside teaching, seminars, patients can co-teach history taking, communication, and I think that I believe it will be of a lot of importance in the coming future, which is shared decision making of the many possibilities that are there. And authentic exposure matters more than volume. I will say that single patient talks is not so useful as having a longitudinal contact with a small cohort of patients throughout time. And if we track outcomes and communication, also patient-reported satisfaction with PREMs as well, I believe it will help us shape the bright future in front of us better and better.
Perfectly said, Diego. And I think it almost sets us up just to bring in Geordie and the paediatric perspective to look at, on the back of that comment from Diego, you know, how can healthcare systems actually better evolve to involve young people and families throughout their journey, from no matter what point they're diagnosed all the way through into adulthood? How do you think the system can evolve to make sure that paediatric care and transition into adult care is seamless and fit for purpose?
I mean, that's a good point. I mean, I believe there are different experiences in proving that through all Europe, and there are models that we can use. I mean, transition is the key point, as it's one of my dreams, and one of the points is to have it integrated, and it's not just that there is a date where it starts. It's from the beginning to prepare these young kids and working with them. And yeah, I believe that the impoverished of the kids must be addressed particularly. I mean, it's not the same as I talk to a 12-year-old or 18, and the system can adapt, and there are nice experience working with kids, making them participating in groups to advise how they want them to be cared, and that can help to improve the way we care of them in our centers. So that's a long path, but it's already been started.
But
It would help to keep my microphone off. I still do that now, even after all these years. No, really nice point, Geordie, and I like the early, you know, transitions should start early. I remember a late colleague who passed away early this year, Janet Madonna, who many of you will know as a real leader in transition. And I remember one of my first interactions with her, and we was talking about the transition versus transfer, and transition is not the transfer. That's a point. the transition is that slow build up of skills, competency and support, and a support network for young people moving into adult care.
That's a point.
So we are nearly at time, and I want to make sure that anybody who has a burning question in our audience has the opportunity to ask them. So we still have a couple of minutes left if you have any questions. And if not, I do have some more. So I want to come back to you, Caroline. So one of those points which we touched on earlier was around giving young people a voice to shape change. So obviously you have got involved with Young PARE, you're doing fantastic work and demonstrating what's capable and what's possible when you feel able to step up and get involved in different activities like Young PARE. So if there anybody on the watching live or on demand who wants to get involved, what would you recommend they do?
I would recommend to first get in touch with your local organization. I think that's the first step. Find out what is there in the first place. Is there maybe a group or a meetup or something for your age group? And if not, maybe you want to create one. But yeah, I think the first step is to get in touch with your local organization. Or for young people, I think the way to go is usually social media. I think a lot of people just reach out through social media, tell their stories there, and yeah, and find a voice over that format. But if that's not something you want to do, regarding, for example, the question we had earlier about doing it without openly telling people you're a patient, I think the best way to go is to go to your local organization and be like, hey, I'm here and I'm interested and I want to give what I can. And then they'll find you something to do, usually.
There's certainly plenty of work to do, and I think that's a really lovely point to end on, the power of patient organisations and really the support and the influence that patient organisations have in working with all of our colleagues across rheumatology to make the future brighter for people with RMDs. And so as we come to a close on our World Arthritis Day 2025 webinar, I'd like to thank all of my speakers, my co-chair Caroline, and everybody who's joined today and who will be watching on demand. Achieve your dreams is much more than a slogan. It's a reminder that by listening, by collaborating and supporting one another, we can help people with RMDs live the lives that they choose. Please keep sharing your thoughts and dreams online using RM Dreams and World Arthritis Day, and let's keep working together, collaborating and supporting people with RMDs into the future. Thank you so much for joining and enjoy the rest of your days.